Welcome to the Phoenix Prosperity Podcast, where wealth meets legacy. Join your host, Tim Fergestad, as we explore the journeys of Phoenix's finest to success and beyond.
Hello, this is Tim Fergestad. Thank you for joining us. Today we're joined by Dr. Johnny Serrano, a pioneering general surgeon and one of the early leaders in robotic and ultra-minimally invasive surgery with over 5,000 laparoscopic procedures performed and a true concierge surgeon-led model of care. Dr. Serrano is known for bringing cutting-edge technology and deeply personal attention to every patient he serves. Welcome to the show, Dr. Johnny.
Thank you, Tim. Thanks for having me.
Excellent. Is Dr. Johnny all right? How do you prefer? Dr. Serrano?
Dr. Johnny, Dr. Serrano, whatever you like.
All right. Excellent. Excellent. So you're here. I do the podcast out of my house in the West Valley. You're on the west side as well. Is that right?
I am on the west side, yes.
Okay. Excellent. Excellent. How long have you been in Phoenix?
So I came out to Arizona in 2003.
Okay.
And at that time, joined up with another group. So, yeah, I've been here about a little over 20-something years.
Okay. Okay. Excellent. You beat us. We came here 20 years ago. So you got us by a couple of years.
Yeah.
Excellent. Excellent. So, what would you say has been sort of the biggest challenge let's back up. So you came here and started working with another group, and now you run your own practice. Is that right?
Yeah. So when I came out, I just had finished residency. I actually worked 3 years in Brooklyn, New York with the chairman of surgery there. After about 3 years, I always felt I wanted to come out to Arizona, so I tried my luck here. I joined the group because, again, I wasn't very sure about the area, and it just provided that security to be with a group.
Sure.
So I stayed on the group. Yeah.
Sure. I was going to say it's a whole new level of challenges just going out into your own practice, much less trying to also start a business and learning all that at the same time.
Yeah, and surgery is not kind of something where you can just open up shop right away. It's not like people walk down the street like, oh, there's a surgeon here. We should go and get our. They go to where they're referred,
Right.
Or the reviews they see. So that's why I joined the group, and I was with them for about 5 years, till 2008. Made a name for myself, had some colleagues referred to me. And then I decided I think I'm stable enough to go solo. So in 2008, I opened up Precision Surgery Incorporated.
Okay.
And I chose the name because I felt that I want people to know right off the bat what they're getting with me. I feel that surgery should be precise. It should be, one time, none of this, well, let's try again. Let's see what happens. I don't like that. And again, that's why I'm solo. I take very personal all of my surgeries and all my patients. I feel like my practice is more of a concierge type of network for them.
Okay. Yeah. Talk about that and the sort of the changes in the medical field in general and how that's pretty unique nowadays.
I think many people can relate to the fact that medicine has changed a lot. Even now, when you go, hardly ever you'll see, the doctor, you'll see the nurse practitioner, you'll see the PA. And that's all and fine, but a lot of times people want to see the physician, and they'll come in with their laptops and their computers and they're clicking away, right? While you think that they're paying attention, but more they're just checking off.
Looking at the screen, right?
And even when you call the doctor's office now, you'll get press 1 if you want to talk to billing, press 2 if you want to talk to the MA, press 3. It's like, how about
scheduling,
I just person? So in my office, when you call my office, you'll get my secretary. And if I'm there, sure, hold on, let me see if he's busy. But it's nothing, like, let's check the department, where are they at? It's kind of crazy now the way things have evolved to. Even me as a physician, I cannot call another doctor's office and say, hey, let me speak to Frank. Who are you again? I'll take a message. And like, just tell Frank I'm on the phone. It's not like that.
Right.
Like that.
Right. Yeah. Very, very different. So when you say surgeon-led model of care, I mean, you're the guy. You're there in charge. You're running the show all day.
I'm the only surgeon there. I don't have nurse practitioners. I have assistants, medical assistants, but they don't participate in surgical care. I use a lot of medical students for my assistants in the operating rooms. So the medical students have the privilege of following me around, and they
Okay.
get one-on-one with me, with the surgeon, not with a resident or an intern who's learning themselves.
Right.
They
Yeah, that's awesome.
get one-on-one with me. So one-on-one in the office, one-on-one in the operating room. They follow me around to each room. If I have 4 students, then 1 student per room. And I feel it's a more um, encompassing type of teaching for them.
Sure, sure. And how long you been training?
I've liked training all along. So as soon as I moved here in 2003, I got associated with the Arizona College of Osteopathic Medicine.
Okay.
And I started with them, and now I train with AT Still, Guadalajara, and St. George.
Okay. Okay. Very cool. Very cool. Well, I think that can be demanding, right? Because it takes a little extra time and it can slow you down, particularly in a private practice, to have to train. But I think it's rewarding in its own right. So that's kudos for doing
Very
that.
much. I just feel like you have to give back because these kids, they're our future, and at least one rotation should be good for them. I promised myself that if I ever had the chance as an attending, I would give back because my rotation in surgery was so bad.
Oh,
Sorry to say.
really?
It's a miracle I became a surgeon. I loved it so much, and that's what kept me pursuing. But the rotation itself was not good. So I told myself, I promised that if I became a surgeon, I would make sure the students that came to me month to month, they would learn something, whether they wanted to or not. Because some of these kids don't want to be surgeons, and I get that. That's fine. But
Sure.
unfortunately, you chose this rotation, so you're going to walk out of here learning something. You're going to walk out
Right.
stronger than when you came in. Sorry about that.
Well, surgery, I think most people understand that, but surgery is a very demanding specialty, right? And it's not for everybody. You have to really love it, I think, to endure all the challenges associated with it.
It's not for everybody. It's not for people that like to place blame. Good or bad, the result was mine. I have to accept that. Whether I did a good job or a bad job, that was me. It's mea culpa.
Right.
It's not the nurse. It's not the tech. It's not this or that or the situation. It was me, period. And people, not a lot of people like to do that. They don't have those kind of shoulders. And not a lot of people like to be in the
Right.
spotlight. As a surgeon, everybody's watching you. Anesthesia's watching you. The nurse is watching you. Recovery room's watching you. The residents are watching you. Students are watching. Everybody's watching. So if
Right.
you don't like to be in that spotlight, this is not for you. You don't like that responsibility, right? When you're taking someone's husband back, someone's wife, someone's brother, sister, their son, their daughter, that's a lot of responsibility. They're like, please, doctor,
Sure.
take care of them. Of course I will. I'm gonna take care of them like they're mine. And that's what I tell them. I treat them like family. All my patients, I tell them, I treat you the way I want my family being treated when they go to the doctor. I don't like when doctors overwhelm them with this, doctor-nese gobbledygook, try to talk over them, surround them with things that they don't understand. Why are you speaking to them that way? They don't understand that. Speak to
Right.
them the way. Now, if they're educated, of course, you speak to them that level, but you have to understand where they are so they know. And the fact that I'm also Spanish helps a lot. A lot of my
Okay.
patients are Hispanic, and you can see the relief on their face when they're trying to
Sure.
speak. And I can tell, like, they speak Spanish, like, habla español. They're like, yes, like, oh, you speak Spanish? This is great. You can see the relief on their face because
Right.
now I don't have to try to, explain it to you. You get it.
Right. Right. And their family members or something, right? There you get all sorts of dynamics there, which it can be very relieving. That's great. Can you speak a little bit about the challenges of running your own shop in this day and age?
That's, I can't say I've had any formal training. I don't have an MBA or anything like that. I had a father who did run his own business, his own gas station,
Okay.
had a repair shop. So I tell my dad, I'm a mechanic too.
Yeah, you run your own shop.
And I have to get it right the first time. I can't do it.
Right.
Let's fix this and whatnot. So kind of watching him, being very calculated with the books, writing things down, and just keeping an eye on things. And one thing he told me that always resonates with me is like nobody watches your money like you. No matter how many assistants you have, bankers and this and that, nobody watches it like you. So
For
pay
sure.
attention and blah, 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 and things like that. That's why even now I have a little notebook. All the procedures I do, I write them down. End of the month, me and my village, we get together. I said, okay, tell me this, 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 this. And we do it like that, and it's
Okay.
because I have a smaller office, I can do that. I have the luxury of that.
Okay. Has there been a optimization over the years to find the right size and the right number of cases per week that allow
No,
you to keep the
for me,
quality of care?
I haven't gotten to the point where I say, oh my God, enough. Please, more and more.
Okay, you're
I
still
would like more. Coming from the East Coast, we're used to high level, high volume. I,
okay.
that's what I went to go study in Brooklyn surgery because I figured, let me go somewhere where I'm going to get, training in, hardcore with stabbings and gunshots and things like that. And every place else will be easy. So that's what I chose.
Right. Okay. Okay. Yeah, talk a little bit about sort of your specialties now. I mean, because over the years you start getting known for certain types of cases, you start doing more and more of them. What are sort of the range of procedures that you like to do?
So I enjoy complex abdominal wall hernias that people have had repaired in the
Uh,
past and then they failed.
okay.
I enjoy those type of hernias because they're life-changing for the patient. Where they unable to walk or just unable to function because their intestines are just sticking out, and I enjoy that. I enjoy giving them back their lifestyles. So
Right.
that's definitely one. But honestly, I just enjoy it all. I always tell my wife, maybe I'll start slowing down and I just start doing this and this and that. And then I say, but I miss gallbladders and I don't want to give gallbladder. I kind of like hernia still, and I like veins too, and I like it all, and I don't want
Okay.
to.
Is that hard in this day and age to try to stay broad?
Well, I like the general surgery part, and that's actually why I chose general surgery as
Okay.
opposed to I thought I wanted to do cardiac surgery and just do
Okay.
heart surgery. But when I
Hmm.
tried it for a month, it got very monotonous to me. I didn't like the fact that, what are we doing on Monday? Another valve,
Right.
another bypass. So, but there are people that thrive in that environment. They love that,
Mhm.
and that's for them. For
Right.
me, I knew I would get bored, so when I'll start out the day with a breast surgery, then a hernia, maybe a vasectomy, and end up with varicose veins, and it keeps me entertained.
Okay, excellent, excellent. So, what are some of the I guess the hurdles right now for practicing and trying to keep your practice going or growing?
I think the biggest hurdle is just trying to understand this whole social media thing for me. I'm not very savvy on it. I do dip my
Okay.
toe into the TikTok and try to figure things out like that. But I would wish that the views translate into patients through the office. That would be great. So
So
it
so
happens like that.
sure. How much of your business is people finding you on their own versus like referrals through their
I
primary?
I would say the primary has a lot to do with it, but there's a good portion of Google that works. And I do
Okay.
have a person that, kind of, maximizes my SEC, things like that. But I do notice that Google right now works extremely well. A lot of times people come, but they don't even have doctors. They have good insurance through their companies. So they'll
Okay.
just Google, or they'll go to their provider's website, and I'm on there. And that's
Okay.
the best is a referral from a friend. You operate on my
Sure.
money, and he told me about you, and that's why I'm here.
Right.
That makes me feel great.
Yeah, for sure. Those are the best, for sure, for sure. Um, how about are there challenges in terms of reimbursement and which insurances you can take as a smaller practice?
The reimbursements are very difficult. Just trying to be reimbursed. I mean, you've seen a couple, I'm sure, TikToks where physicians are talking to these people who claim to be their peers, and they're deciding whether they're going to okay the surgery or not. But sometimes, let's say this person is a plastic oncologist, and the person they're talking to who's okaying is an optometrist. What
Right.
do you know about what this person's doing? And they're
Right.
making decisions. So that part is difficult.
Very frustrating.
Dealing with insurances, it's the only profession I know where you do something and you don't get paid for 3 months later. That would be like
Right.
a plumber coming and say, "Can I, you're coming today, but can I pay you in February?" Like, why?
Right.
So, and then they would come back and they say 60 days later, "Oh, now we need, medical records." Well, why didn't you say that at the beginning? Because now
Right.
it's been 2 months. Now we send the records. They say, "Now we need 90 days to review the records."
Yeah. Yeah.
I
It's a
think nowadays
shell
with
game.
ACH and, just electronic billing, it should be easy. You see I'm a provider, boom, I did the service, just put it in my account electronically. That's it, done. Thank you. It shouldn't be that hard.
Are you able, how much of your team is in-house and how much like third-party sources or for services do you use for trying to
So my
balance your OR time with running the business?
yeah, my billing team is out of house.
Okay.
Other than that, I do have a computer um, people, mostly off premises. But yeah, mostly it's kind of a lean and mean. We run a
Okay.
tight ship there.
Yeah, I'm with you. That's kind of what I do now at this point. I have colleagues who have uh, bigger investment groups, and when they're in real estate, and you have a team, right? Like kind of like a contractor, or a developer. You can't just let them all sit around doing nothing, right? So they transact and they go even when the deal's not good, right? And so I'm very picky, and so I didn't do any deals in 2024, right? We've done a few this year, but right, it's nice to be lean and mean and not have to be forced to do stuff when it doesn't make sense.
For sure.
Yeah, I'm sure that gives you a lot of freedom that these bigger groups don't have, which is nice.
Yeah, and that's the thing, me being solo, everything I do is for me, you know.
Right.
I'm not splitting anything with anybody, and the only thing that holds me back is me. So whatever doesn't happen is because I didn't make it happen, and it's also vice versa. If I don't make it happen, that's
Yep.
bad for the company too.
For
But
sure. For sure. That's kind of the nature of right, being a entrepreneur, solopreneur, right? It's sort of that eat what you kill
yeah, and
scenario.
this COVID pandemic that hit us in 2020, it really did a number in the practice because I used to have, let's say I had maybe 25 independent physicians that would refer to me.
Ah,
And after the pandemic, I noticed that I hadn't seen them in a while. So I actually reached out. Hey, what's going on? Oh, hey, we're sorry. We meant to reach out to you. Yeah, we got bought out. So they get bought out to with these big conglomerates like HealthyU, Village
okay.
Medical, and then now they have to refer to their surgeons in that network. And
All right.
so that each year gets harder and harder. It's just
Sure.
difficult, more difficult.
So what are your thoughts on creating income outside your business and planning for retirement?
I've always been a squirreler. I've always, put money away. I've always, have my investors here and there. So I'm very diligent about, squirreling my money away.
Okay.
Outside of the hospital, I don't really have interest as of yet. My son is a realtor, so I'm thinking about,
Oh,
you know,
okay.
towards that direction.
I'm a
Um,
big fan of real estate. I gotta confess that. That's how I started, right? I got my license. I wanted to flip and hold smaller projects and stuff, and then just kept growing and growing. And ultimately, I sold all my single family rentals, but do the bigger projects now.
yeah, I'm just
Um,
shy of things that are not medical related.
well, you stick with what you know, right? Which is kind of it makes sense, right? And a lot of people, particularly when they have their own business, they reinvest in their own business a lot of the time, and until they get to a certain point, they realize they have to start diversifying and planning for an exit or something.
Yeah.
Okay, here's a question I have. I like to ask people is what have you done this year that's changed your life?
Changed my life.
Yeah.
Wow.
Some people it's travel, some people it's a life event or something, but maybe even a good book.
Um, Not this year, but I would say about 2 years ago, I believe it was 23, when I
Okay.
actually wrote my own book.
Oh, really?
And
Tell us about
that,
that.
yeah. So the title is Becoming a Surgeon.
Okay.
And it was more meant for me to be able to read my journals as an older person,
Okay.
just to read my life.
Yeah,
It
reflect.
came about from my daughter giving me a book about this plastic surgeon and how he went through his residency and things. And when I finished, she asked me, "How'd you like it?" I'm like, "Oh, it was all right." She's like, "Oh, did you like it?" I'm like, "I didn't like it." She's like, "Why?" She's like, "The stories were so bad." I'm like, "My stories are so much better." And then she said, "You should write a book." I was like, "I should write a book." She's like, "You should." And then I was like, "I should." and that was it.
All
And
right.
from there, it took me about a year after that to get them all, down on a recorder. I would just record anytime I had free time, just record, and then I had to type it. So it took a little while, but it came with Amazon and everything. And I was like, oh, it does? Okay, sure. I just wanted it to be bound, really. So yeah, it's just something I can look on and say that changed me because I was able to go through my whole life and just put my heart on the sleeve, basically. And I've had
Awesome.
colleagues read it and tell me, you know what? You made me cry. I'm like, really?
Oh, wow.
Because that was my intent, but I'm not a writer, but that's great that I was able to come across the page like that. That's awesome.
Yeah, it is. That's very cool. Very cool. Did you write that at all I mean, becoming a surgeon, the title implies that that's something as a mentor you could maybe give to the students that rotate through and such as well?
It's offered. In other words, I don't want to say you have to get this book. I said, this is something that I think could benefit you if you're thinking about surgery, what it's about, what I feel when I go inside to surgery. It's not all rainbows. Sometimes people don't make it. What does it feel like when you lose a patient? When I was a resident, when I was an attending, what's that feel like? So, it was that's what really the book was all about. Was my experiences and what it feels like to go through and become a doctor. It's not, everyone thinks, oh, you just make millions. Like, well, it's hard to get there.
Oh, yeah. Doctors have a lot. They sacrifice so much of their life and so much of their time to get to where they are. And then once they're practicing, people think they're out on the golf course the whole time. No, they're in the OR practicing or in the clinic. It's a lot of work.
Yeah, and as surgeons, out there saving lives, and I wish I could just throw the football and get 10 million, but
Oh, well, so you guys are heroes. Thank you, Dr. Serrano. So that's on the legacy side of sort of where I was going next. You wrote a book. You're giving back. You're training people. Is that sort of the bigger focus for your professional legacy anyway?
yeah, giving back. I guess my whole life,
Your
if I could,
practice already has a ton of impact.
yeah, I've always gotten joy from giving. I've lessened whatever is happening to me to be able to help someone. I've always, in medical school as an EMT. If I look back, I've just always been that servitude type lifestyle, put others before me, which is, that's kind of surgery is. You could be having dinner and you gotta go. Sorry. Yeah, some patient's more important. And my wife knows that. My wife accepts that. She's like, absolutely, anytime that takes precedence.
That was something my wife did a few years of surgery residency before she switched to anesthesiology, and she liked it, but she didn't
Very
love it
smart woman, by the way.
enough. But it was she realized even when you're not on call, you're on call because it's still your patient, right? And you're never done. You're always on, and that was a big commitment, and it was a little, I think, overwhelming. I think for to think of doing that for decades.
Well, the way it used to be was like that. But even now, with these big surgeon groups at 5 o'clock, it's click, checking out, you're on call, you're responsible for my patient, I'm leaving. Even when I was in a group, I would tell my partners, listen, if anything happens with my patients, I know you're on call for the weekend, but I'm here in town. If I'm here, you call me. Don't touch it. I'll take care of it. And unless I was in, Vegas or New York or something, I'd say, you call me, I will deal with it. So it came to the point after a couple months and years, like, hey, how come you never call me? Like, I didn't get any calls. It's like, that's weird. I get a lot of calls on your patients. So then that's when I realized, like, I could do this on my own. What are they doing for me?
Right.
That's when I decided to go solo.
Okay. Okay. And no regrets?
No regrets, other than the fact that I wish that it was just, pay for service model. I do something, I should get paid for it right then and there, not 3 months later, not have to fight
Yeah.
for it.
Right. And fight
You're a
for 20,
professional.
25% of it.
Yeah, you're a professional. You should get paid when you did the service, not later. And that's the only gripe I have. I wish I was like my plastic surgeon colleagues who get paid before they even touch the patient.
Oh, cash or yeah.
Cash or whatever. I mean, that'd be
Right.
nice. But in the end, I still love what I do, and unfortunately, that's why I stay because I still
Right.
love it. I
Yep.
just did a hernia surgery on a lady couple weeks ago and, changed her life. She had 6 surgeries. She almost died. And she's like, thank you so much for taking the surgery. I went to 4 other surgeons and they told me no. But she's like, I felt it when you told me that you could possibly do it. She's like, I know, I trusted you. And,
Nice.
you know, and she's like, she brought me a present for my birthday.
Awesome.
December 1st.
All right. You're on the Christmas card list forever.
I said, don't spend your money on this. She's like, I wanted you to get something. I was like, no. I was like, you're my Christmas present. Look at you.
Right?
Look at you. She's like, look at me. She's so happy.
That's awesome. Very cool. Very cool. Okay. So, do you have any exciting plans coming up for 2026? It could be
2026, we usually do our annual, we still do our annual vacation. The kids still like to go to Puerto Vallarta, Mexico.
Oh, nice.
But they're reaching that age. My son will be 16. My daughter will be 15. So soon enough, they're going to be like, we don't want to go. So I'm still taking advantage that they still like to go.
Okay. Yeah. Yeah. I have an 18 and a 16-year-old, a boy and a girl, and they don't want to spend a ton of time with me anymore. I'm not that cool.
Yeah. So I take advantage of with my son now with football.
Ooh,
he's a big football savant, basically. And I take advantage of being with him on Sunday. Even I don't know much of anything, but he loves me sitting there. He talks to me, tells me about the players, and I'm like, really? Wow, that's crazy. I don't know anything about this guy, but I just tell him, wow, that's amazing. Really? Oh, I saw that. And he loves talking about it.
Okay. Awesome. That's great. That's great. Okay. Okay, Dr. Johnny. So reflecting back, what do you wish you would have known sooner about building wealth and success earlier in your career?
I wish I would have known about the varicose veins sooner. Varicose veins is very prosperous. It's been my saving grace for my office. I wish I would have known that I could do it in the office sooner. It would have been great.
Okay. It's just what's so great about it other than the reimbursement per time?
Very good. The reimbursement is very efficient and quick.
Okay.
The doing it is not extremely difficult. Very little as far as complications go, and only really upside is benefits. Plus the fact that there are 30 million Americans with varicose vein disease right now. And only 2 million seek treatment. There's a lot of people out there with varicose.
Oh, wow. Okay. Didn't know that. Is it?
I have places popping up.
Huh. Interesting. Okay. So is that something that's something people can come in, they don't need a referral for. They can just, if they have something that concerns them, they can just book an appointment with you directly.
Absolutely. Yeah, all private insurances pay for it. I believe it's something that at the age of 55, when we're getting all these, tests like the mammograms and the colonoscopies and, EKGs, things like that, I think the veins, at least at the age of 50, we should have them checked because the symptoms come on very slow. Okay. My legs feel tired. My legs feel heavy. Oh, let me put my legs up. Mom, my ankle's a little swollen. So people think, and then, the little varicose veins they see popping up. Oh, yeah, I'm getting older. My mom had those. My grandma had those. Sure, they did. But if they show that the valves aren't working, there's reflux in it, guess what? Insurance understands. That's a medical problem. That's not a cosmetic problem anymore. Of course, the insurance is not going to call you and say, hey, we pay for varicose veins.
Right. You gotta be proactive.
Yeah, proactive. So.
Okay.
That's what I'm here for, to fight for the patient. Let them know your insurance will pay for this.
Okay, excellent. Okay, Dr. Serrano, if people would like to connect with you and learn more, where should they go? What can they do?
So my website is precisionsurgeryaz.com. Very comprehensive website. Lots of things on there. All my services that we do. I am on TikTok, but again, like I said, I'm very non-savvy, but I'm pretty sure it's JL Serrano. That's really it. You can Google Johnny Serrano Precision Surgery. It'll all come out there. I have 249 reviews at 4.9.
Oh, wow.
And they're all real.
That's awesome. Very good. Yeah, that's a great testament to your craft and your care and dedication. So that's a lot. Okay, well done. All right. Well, that's all I got today. Thank you everybody for listening and watching. Thank you very much, Dr. Johnny Serrano, for joining me today. We very much appreciate you sharing your story and your success and the impact you're having here in Phoenix.
Thank you, Tim. Thanks for having me.
Inspired by our guests? Visit phoenixprosperitypodcast.com/guest and join us on the show and share your success story with Tim. The spotlight awaits.